In this video, I have a discussion about hypermobility, and the discussion is with another physical therapist who is credentialed through the Postural Restoration Institute, and we have a wide-ranging discussion about hypermobility and the difficulty in treating the hypermobile client or patient. Also, the connection to long COVID, people with symptoms. There was a study in the UK that came out that said that people who are hypermobile are more likely to get long COVID. So we talk about why that is and why long COVID and hypermobility have people with these issues have quite often mast cell activation. And there's this underlying issue of inflammation breaking down connective tissue. So you have to understand that hypermobility is not flexibility. Hypermobility is a connective tissue disorder. And connective tissue is found everywhere in the body. So quite often people will have loose ligaments and tendons that can cause joints to be too loose. And that can be difficult to deal with postural restoration to help them restabilize. You have to understand this is all coming down to the autonomic nervous system, which is what postural restoration does anyway. We're always working on the level of the autonomic nervous system to decrease tension levels. People who are hypermobile, and I've done a video on this, it's a little bit harder because their interoception, their sense of their own body, is usually lacking. So it becomes very difficult for hypermobile clients and patients to feel their own body. Hypermobility is also involved in mood disorders, chronic pain, depression and anxiety, pelvic pain, sexual dysfunction, ankle sprains, more likely to sprain ankles, their elbows and knees hyperextend. They're just unstable. So this discussion touches on all of this. And yes, postural restoration can help hypermobility. I also offer my own experiences with mast cell activation where I had this histamine issue, histamine intolerance, that I no longer have anymore. And I go back to because I made a video about this previously, years ago, and some people think I was full of it. They think it was ridiculous. Other people were fascinated by it. But there's no doubt the connection is there, and it is in the literature. You just have to understand that the underlying issue is a dysregulated autonomic nervous system, whether it is mast cell activations causing overactivity or overreactivity to the environment or to food. The underlying issue is autonomic nervous system dysregulation, also in long COVID and in hypermobility in general. So this is the discussion that I had with Amy Morris from Pennsylvania. She mentioned, she's like, oh, there was just a study in the UK that said that people who are hypermobile are more likely to have long COVID symptoms. And I said, that matches exactly what I've been saying for years. My own observation was that these long COVID symptoms are very similar to the things that we treat on a consistent basis in postural restoration when people are, I call them just neck patients. So because their neck's going to be tight and just telling me that their autonomic nervous system is dysregulated. So that overlap, the underlying issue would be what? The fact that the soft tissue disorder dysregulates or creates difficulties with autonomic nervous system function, regulation. Like, what is it at its core that hypermobility causes?
Oh my.
Or it's a result of something.
So are we talking about long COVID or are we talking about being toned up?
Just
two different topics. So I'll answer both, but which one do you want me to answer?
Actually, we could do both because I think it would be something that people might be interested in. Let's start with the long COVID issue.
So long COVID is probably been around forever. It's just been called something different.
Yeah.
It's really just where our bodies just get into this cycle of inflammation and pain and the fatigue, and you're just in this chronic inflammatory state.
Right.
And the thing about connective tissue disorders is that one of the comorbidities is mast cell activation. And so mast cell activation is one of the things that can create a lot of drama. So let me back up. I said earlier that you can have hypermobility. You can be born a little little flexible, right?
Yeah.
And then you go to gymnastics and dance, or you play, you karate, your sports, whatever, and you age. And women tend to have much more issues with hypermobility because they have all the hormonal influences, but
Okay.
men can have it terrible too, absolutely. But you get to your young adulthood and you're eating crap, you're living on sugar, you don't have a great lifestyle, right? You're abusing your body, and you just get more and more inflamed. You get Lyme disease, you get whatever it is. And then our bodies just start to break down the connective tissue more and more. So we
Yeah.
tend to get worse. We get tighter as we age, but the inflammatory portion can get worse as we get older. And then you get hit with something like long COVID, or COVID, I'm sorry, and then it becomes this inflammatory process that we can't seem to clear.
Okay.
So it's just something that tends to go with hypermobility, not always, but it tends to go with it. It's a comorbidity. And so the long COVID is really in that mast cell activation bucket that also is with chronic inflammatory things that go with mold, Lyme, Babesia, Bartonella, all the Giardia, all the chronic strep things
Yeah.
that we can have.
So, and that's where people get so frustrated, is then they say,
Which
"Well,
is
what do I have? What do I do first? The doctors can't help me."
functional medicine. And that's really, I mean, that's where I counsel my patients lightly nutritionally. I talk to them about the things that are triggering, and I give them some gentle recommendations on really safe supplements. And then I beg them to go and get tested for these are the ones that are really sick, all of the chronic inflammatory diseases, because if you just keep inflamed, no matter what, you're just gonna keep breaking stuff down. And we want to get you as uninflamed as possible. And that's partially a lifestyle issue. That's not a physical therapy issue or a personal trainer issue, the inflammation. However, we can counsel, right?
Yeah. So that, I think that's because again, this whole thing of, hey, do this one exercise to fix all these issues. That's not how. So how would you know whether you have an issue that can be helped with physical therapy or something like posture restoration, or whether that's really not even the direction you should go at that point in terms of priorities? Now, of course, they don't exist.
It can help everybody.
Yeah. So I know they don't exist independently, obviously.
No.
There's always crossover. But how would you get someone in this situation? Let's say they have long COVID, because I think I'm fascinated by this. Because people are in such a state of, they're experiencing basically disabling symptoms. Their lives are just turned upside down. And my own mother has been dealing with this for years. So, and she's on the Facebook group, and and it's funny, they talk about mast cells on the Facebook. They talk about all these things that are already known about. But none of them they're all at a loss for how to treat these symptoms.
Well, I think that most important is you validate them, because our healthcare world is not great at that.
Yeah.
And then, I've done a lot of training in nutrition, and I'm a bit of a nerd when it comes to the whole functional medicine, reading up on all that.
Yeah.
I just read a textbook on mast cell activation was my summer read last year. But I'm far from an expert, because as soon as you go one layer, you keep going.
It's never ending.
It's never ending. And so, I mean, and of course, how many resources do people have?
Right.
That's the problem. And God bless our functional medicine world, but insurance won't cover all of this testing. One of my patients just spent $2,300 to do an extensive viral Lyme testing and viral and all these $2,300 just for the blood work.
Yeah.
That's not even the treatment.
Yeah.
That's just for the blood work.
Yeah.
And then, so it's really hard and heartbreaking.
Yeah.
And even, I have plenty of patients that have all the resources in the world and they're chasing their tail. But I will tell you, my people who do well, you have to, it's all about lifestyle change. Clean up your diet, right? I know people don't want to hear that, but they
definitely don't want to hear that.
Yeah, I know. And that's part of the issue, is that if people don't want to hear that, the cleaning products they're using, their hair care, the food, all of that. If you clean up your environment and your diet, I have a child with mast cell, right? So, I mean, adult, she's an adult now, but she started in high school with crazy rashes and ITs. I'm like, her face will just peel off sometimes. And we're all like, oh my God, what happened to you? And it's simply nothing more than just having eaten something she shouldn't have.
Right.
So we've learned that if you can clean up your diet and clean up your environment, and then that's going to take a brunt of it, well, it's going to help. And then you have to figure out, do you have the dreaded mold gene or the MTHFR gene or any of that, and figure all of that out. It's a very slow process, but along the way, as PRI people and as healthcare practitioners or trainers, we can validate, support, and then give them tools and resources to manage. Because no matter what, as they're on their journey, I feel like we can give them, it's always going to help someone to be strong appropriately and to get repositioned and to, I mean, I have my patients who they do their exercises that they know. I give them, here's 3 things, try that for a week. Let's see where we're at. And it helps. It's not an answer, but it's part of the equation. Well, and you said 2 things that I want to comment on, which is that, somebody wants to be fixed. Well, that inherently means they're broken.
Right.
So, I mean, I think like trying to remind people that you're not broken, right? You don't need to be fixed. You just we need to figure out how to make you more comfortable in the body you're in, right? Like not inherently broken. And it's about management, and that having tools is going to help you get out of fear. And that's what I manage. My practice is primarily people who have chronic conditions, and it's all about management. And there is no cure for hypermobility or osteoporosis or scoliosis. Those are all things that we manage. And that my number one goal with every single person is get out of fear and feel like you've got some sort of control is not the right word, but that you can influence how you feel. And I don't think anybody who knows anything about pain science can disagree that pain is very subjective, and you can have the same pain when you're at, a party and you're having a great time versus when you're, fighting with your kid, and it's 2 very different experiences. And that the quote, my favorite quote, but I try not to be flippant, is, you can, pain is not something you choose, but you choose to suffer.
Okay.
And are you, we all have pain. When you said you have, I mean, I don't know anybody, when I meet somebody who says they never have pain, I question if they are living in their body at all.
Right. Yeah, it's part of life. It's intertwined.
Pain is part of life, but suffering is optional. And,
that's the quote.
It is.
Pain is real, but suffering is man-made. It's how you react to the pain.
Yeah. And I mean, like, that sounds really flippant, especially when somebody's sitting in your office crying for their chronic pain. And I don't ever want to come off that way. But if I see it all the time when I have somebody in my office with this huge scoliosis and they're so scared they're going to have surgery. And I ask them some basic questions and I'm like, we got this. It's fine. You don't seem like you're somebody who's going to be surgical to me. Maybe they are. And then we have that conversation and I say to them, I have a referral for you. And by the way, you're going to be okay. Right. Like this is like it. I think hearing that and talking about these are the steps and this is what we're going to do. And, taking the fear away makes everything much better. Not all better, but much better.
Absolutely. And man, I didn't even think about discussing pain in this. I'm sorry. I didn't even think about discussing fear, but the fear issue is so pervasive.
Safety is key.
Yeah. And I mean, I have younger people. I've seen kids basically in their early 20s who are so anxious about what they're experiencing.
So
they're testing from a PRI perspective, like there's nothing wrong with your body. There's nothing wrong with their body, but something is going on. And I feel like their visual systems are playing a role because of some of them can't do the simplest PRI techniques. So I mean, optometrists do know this to a degree, that it's not great to look at screens, but these individuals, this age group, and I know there's a kind of a book going out that's out now that it's called the anxious generation, and he's basically just making the point that this is the first generation of people who've really literally wired their brains to a screen as they grew up through childhood and adolescence, and we're seeing what happens. They're like a grand experiment, like what happens when you raise kids on social media and screens and computers from very young ages. So yeah, so I mean, I've seen this quite a few times with younger people. Like there's nothing, they're not patho, like all their joints are stable, yet they're anxious, tense, fearful. And the problem is they can't inhibit overactivity when they're trying to do a peer act. They can't feel anything properly. So, and I don't necessarily have the answer at that point because I'm looking at their test and like this shouldn't, something's not normal here. And
I have gotten into like almost debates with people who are, I can feel their glutes contracting and they're telling me they're feeling their quads, and their quads are completely like, they can't feel their bodies.
so let's talk about that because that's a big issue with people who are hypermobile.
Well, I want to go back and answer that question you had
okay.
before, which is now, like, we've talked about it so much that we're dancing around it. Tone and hypermobility
Yeah.
is fear. So if you think about,
Yeah, that's great.
So thanks for the segue.
That's why I had you on.
Because getting people safe is key,
Okay.
right? And feeling safe in your body is how you can get your tone down. I think that not to go off on a tangent, but the whole polyvagal theory
Yeah.
of nociception will drive you into dorsal or ventral vagal and or sympathetics.
Mhm.
And that's a whole nother tangent, but you can't, I think most people will not argue that there are times that they interact with somebody who make them feel uncomfortable.
Absolutely.
I don't know why.
Right.
Right. There's that person gives me the creeps, or every time they walk in the room, my skin crawls, or, or certain smells or songs
Exactly.
give you a reaction. You
Oh,
tell me,
I know that. That's what.
if you smell chocolate chip cookies, well, first of all, if you don't like chocolate chip cookies, something's very wrong. But if you smell chocolate chip cookies, don't you feel like warm and fuzzy? Where,
Yeah.
like, so that's autonomics.
That's what. Yeah. They'll agree with you and be like, yeah, but those other people, they're just weak. Like, because you pick and choose what you want to experience. And if you didn't experience it yourself, it can't be valid. That's how some people think.
Yes, but I don't think that's, I don't think that's who we're trying to appeal to.
No, definitely not. But I'm just saying it exists. So I'm just putting that out there. So people who doubt, who are made to think that they're crazy because they don't feel safe in a particular environment, and people are like, oh, there must be something wrong with you, or oh, you're making this up. To validate them, this video can validate their experience in the sense that this is real.
Well, and going back to why do people with hypermobility have more tone?
Mm-hmm.
If I commented on those like really flat, floppy feet.
Mm-hmm.
If they can't find stability because they have, they're this little body developing on these feet that don't have a good ligamentous support, they're going to keep flattening it to try and feel more stable, right? They're going to lock out their knees so that they can feel more stable, because instability can lead to falling, and falling equals death in our brain's mind.
Yeah.
Right. And so we have to feel safe, and safety is, I mean, think about the hierarchy of our
Maslow's needs.
Yeah, Maslow's like, think about it. If you're not safe, it doesn't really matter, right? Nothing matters if you don't have your basic needs met.
Right.
And, first world problems, right?
Yeah, absolutely.
Right? Like, we all have to feel safe. And if we're not safe in our bodies, and that's not always conscious.
Right. That's the thing. People, you may not.
And, that's pelvic floor problems. Like these people who come to me with chronic pelvic floor pain, and there's no physical trauma to relate to it, abuse or whatever. I'm like, well, you just don't feel safe.
Yeah.
You have chronic pelvic floor or TMJ, because that's one of our very primitive reflexes, is to bite. If you have TMJ, you likely do not feel safe in your body.
Right. Not that you're consciously aware of it.
No,
and that's what people don't get. They're like, I feel safe. Like, so, and I always try to talk about the idea of groundedness, in the sense that, you're standing on the ground, you can see your feet on the ground and you feel something from the ground underneath your feet. But if you are really grounded, you wouldn't be failing these tests. So, right, so I can squeeze your heel and all of a sudden your hip flexors turn off. I can play a song that you like and all of a sudden your hip flexors turn off, whatever it's going to be. So the idea that what you consciously perceive is not what this part of the brain is actually experiencing. And this part of the brain is what we really care about in terms of the work that we're doing.
Yep.
Because just because you see me, it's still your brain's best guess as to what I look like. It has to guess as to what's out there and whether that's the signals coming from that environment or from inside your own body are signals of, yeah, I got this. There's that appropriate squish and compression of the joint, or oh, there's nothing there. So how your brain is sensing your own body, which sounds weird when you think about the fact that your brain has to figure out what your body's doing. And if those signals are not appropriate, tension goes up and we get stuck in this pattern of overactivity that postural restoration is trying to treat. So can you talk about the interoception, the ability to feel your own body and how that's a little bit more challenging with people with hypermobility?
So interoception is faulty with people who have hypermobility. Although I do want to say one other thing though, going back, just so people have an understanding, the more cerebral we are, the less we're in our body. So you take the people who have like are super high earners, lawyers, doctors, people who are like living in front of computer screens and textbooks, they have a harder time being safe in their bodies because they don't feel their bodies really well. And that's the segue into interoception is different than proprioception. So proprioception is knowing where we are in space. Interoception is feeling our bodies and feeling the our internal self. And what's interesting with hypermobility is that a lot of people have faulty interoception. So I have a lot of my patients who have AMPS and amplified pain syndromes,
Okay.
right? Which is they're feeling their level of pain is not congruent with the injury or the trauma. You know,
Right.
is an ER visit.
Yeah.
You know, and it's not that their pain isn't real. It's that they're hypersensitized.
Yes.
They eat food and they can feel the food digesting, right? They feel their heart beating. Like they have this overly aware sense of their internal function. And then there are other people who have faulty interoception. I call it faulty because it's amped up in some ways and muted in others. So it's hard to know, and it changes. You know, some people, it's like there are times that they're hyper aware and there are times that they're not aware at all.
Yeah.
So I spend a lot of time with my patients in front of mirrors, and I'm a little flippant and I use humor a lot. People will say, well, I feel, I'm like, I don't care. You can't trust you how you feel. Look in the mirror.
Yeah.
Yeah, like I have people walking into my office with this, they're like 4 centimeters off plumb, standing like this. I'm like, well, I feel straight. Like,
Yeah.
okay,
Yeah.
straight, but look at the mirror. I feel, okay, so we spend a lot of time, so I'm such a hypocrite because we'll be doing an exercise and I'll be like, so what do you feel?
Right. We're allowed to break the rules.
Well, of course.
It's situational. It depends on the context.
Well, and I do have them stand, like, say, so what do you feel? And now, what do you feel? And how does it feel? Describe it to me. And then, you know, and when they're telling me that they're feeling that all of their weight is on their right leg, and I can see that they're hanging out on their left hip laterally, I'm like, let's stand in front of the plumb line. Do you see how much hip you have? Yes, but I feel, okay, well, I know what you're feeling. Let's practice resetting.
Yeah.
Let's reset. And we do that a lot.
Yeah. So a practical experience from my own pure eye experience, life as a patient. I didn't know all my issues were coming from my cranium. For the first 5 years that I was doing this, I was just taking seminar after seminar. And, you know, I thought I had a pelvis issue, and which I did, but it wasn't being because of the pelvis.
Well, you have to find the driver, right?
Yeah, I mean, my cranium was running the show. It's just that's where most of my pain was being experienced was in my SI joints. That was the most debilitating pain. But so I was doing PRI techniques for years and years and years, and I felt something, but I didn't know whether it was correct or not because I had nothing to compare it to. Now I know that for the first 5 years, did I feel something in my hamstring? Qualitatively, yeah, I felt something, but was it the correct feel? No. Now what I realize it was mostly cramping. It was more of a cramping feeling, but because I had nothing to compare it to, I thought I was feeling appropriate hamstring activity, and I was not. So I'm very specific with my own clients. All right, they say, okay, I feel this. I feel this part of, like, oh, do you feel your hamstring? Yes. And I say, where? Closer to the knee or closer to your butt? Uh, then okay, a little bit more on the inside, a little more on the outside, and then qualitatively, does it feel like a muscle's working or does it feel more like a cramp? Because those are all clues to me as someone who's been through it, whether they're authentically feeling something, but are they feeling what I want them to feel? And to me, that's the big difference. That's one of these issues. Like these people are going to feel something, but they don't know what they're feeling. They don't know whether it's correct or not. They're just feeling something, so they assume it's correct.
Well, I will say in the hypermobility world, I'm just excited if they feel something.
Okay, yeah.
I mean, honestly, it's taken me 6 sessions with this one girl to have her feel her left adductor, and when it cramped, I almost cried. I was so happy.
Yeah, yeah,
Could not find her left adductor.
yeah.
And it was like, 16 severe debilitating pelvic floor pain, no trauma. And she found her left adductor and it was like the skies opened up and the angels sing. I was so happy.
For
And
you or for her?
for both.
Okay.
I was like trying to, I mean, we're spinning our wheels and I keep saying it's going to be okay. We're going to figure this out. We got this, right?
Was there anything you had to do in particular for this individual? Or was it just a matter of time?
I think it was a matter of time and sort of unlocking her potential and sticking with it and encouraging her to understand that she wasn't doing anything wrong.
Yeah, yeah,
She wasn't stupid. She wasn't bad. She
yeah.
just had never experienced that. And oh, I'm sorry, and convinced her to stop powerlifting.
Oh,
Yeah,
okay.
because she kept reinforcing her negative patterns with
Yeah,
heavy weights because she thought that that's what she needed to do. Because
yeah,
16-year-old girl, right?
yeah,
Need to look good.
yeah,
So there was a variety of things, but mostly just being patient and figuring out how to help her find it.
yeah. My own experience with my skin, I self-diagnosed with histamine intolerance because everything that would set me off were foods that either had a high amount of histamine in them or prevented the histamine breakdown. I think there's 3 different types of kind of like things that can influence as histamine levels. It's been a while since I did all that research, but I went all in into that functional world, and it's so. But it comes down to this bucket of tension, like the tension bucket, I think you were calling it, which I've seen other people refer to it. And so if people can't experience their own body without having to put weight on them, to me, that's still a sign of ungroundedness and a resulting heightened tension and autonomic nervous system. I'm not going to say they're completely dysfunctional. It's just the system still isn't grounded, and thus their tension levels are staying too elevated, which means they're thus going to probably react to things that they probably wouldn't react to if they were more grounded and their nervous system was in a more calm state, which goes back to my mast cell issue or my histamine. There was a time I was breaking out to literally everything. It was
Yeah.
absurd.
The wind can give people hives.
And I had eliminated, there was nothing else I could eliminate. And yes, because I noticed certain things would set it off. And I remember what I first noticed was seed oils, like canola oil, cottonseed oil, things like that. The only one that's still, there's 2 that still make me break out, palm oil and sunflower oil. The rest I'm okay with. There was a time when anything with sugar would make me break out. Anything with alcohol would make me break out. I was breaking out to everything. And then but I had this observation. It was like this aha moment. I put a different pair of sneakers on once because I was out in Seattle in 2018 going to a PRI seminar, the last visual integration course. I was like, I have to take it. That was my second time taking it. So I flew to Seattle just to take this course. But as I went hiking out and I took a couple days off, And I brought a different pair of sneakers that I hadn't worn in a very long time for hiking because I knew the sneakers would get. I didn't have hiking boots. I just had the sneakers. So I brought this extra pair with me, and when I put them on, I hadn't worn them in many, many years. They have a higher arch, and I said, "Oh, that felt good." I couldn't describe why, but putting them on really felt good. And that night, I went out to eat at a Mexican restaurant, and I'm like, "Oh crap! I forgot my antihistamine because the antihistamine would help me not break out." And I was like, "Ah, damn it!" So the next morning, I wake up and I had no breakout. I'm like, "Wait a minute!" And what I started to realize was, depending on what I was wearing on my feet, it would either keep my breakouts either non-existent or very minimal.
Okay, so then can we jump back for a second?
Yeah, absolutely.
Limbic system retraining is a big way for people who are completely at the end of their ropes for histamine and mast cell and like food intolerances, and they retrain their limbic systems to not have a reaction to certain foods and certain things because they're in constant fear. And so when they eat that food, their body goes into a fight or flight reaction. You
Yeah,
have a histamine reaction. So when
yeah.
you put your shoes on, you were safe.
That's what I'm saying. I was
Okay.
more grounded. Tension levels come down.
Right.
I'm
And
less.
therefore your body doesn't have to react. And that's, going back to viruses, if you've got, excessive mold exposure, or you've got, dormant Lyme, your body is in constant fight or flight because it's constantly in a high level of, fighting off something.
Yeah,
And because of that, you're going to have stronger reactions to things. And as
right.
soon, my daughter's the perfect example. She can get away with cross-contamination now, whereas 5 years ago, she would get really significant reactions.
Yeah, yeah,
So, and again, and I think it's very true. It all depends on the setting you're in. If it's if it's a warm, loving environment and things are happy and there's no stress,
yeah.
you get away with being a little naughty. Not, okay, I want to make sure we say, not true food allergies. You're not going to cure a peanut allergy
Right, right, right.
this way. So people should not hear that.
Right.
But, food intolerances
Sensitivities.
and sensitivities, I think there are definite there's definite triggers that are in our emotional system.
Yeah. So, because I even made a video about this many years ago, and some people were fascinated by it, how the resolution of my histamine intolerances. Um,
But I
most,
know people who have cured their food intolerances, most of them through limbic system retraining,
okay.
which is
So,
a meditation process. And I don't know if you know anything about it, but there's there's a couple different schools out there where you spend time every day retraining your limbic system
okay.
and getting yourself out of that reaction.
Yeah.
And it does help.
Yeah. So I always figured that the better proprioceptive input from the ground for my high arches uh, was what was influencing things, that my brain sensed more grounding, so I was less likely to overreact to things that I had never reacted to before. Yeah,
Because your body felt safe.
that's what I'm getting at. Yes, and we're going back to this fear versus
That
safety issue.
fear.
That's what we just break it down to, right? So
Everything is about that.
yes, exactly. Yes, and so because I made a video about that, and some people were like, "Oh, this is absurd," and I knew it wasn't absurd because but I found research not too long ago, but I can't quite piece it together in my mind, that, not to go off topic because it's not completely off topic, that something along the lines of trigeminal nerve dysfunction or trigeminal nerve issues stimulated histamine release in the
Well, the
brain.
trigeminal nerve and the vagus nerve and several and the phrenic nerve, they all anastomose and communicate with each other. So it wouldn't surprise me if there was some sort
Yeah.
of.
So I'm gonna find it and send it to you, because I don't know because I think there's different types of histamine, and I don't know whether this is the type that I was talking about in terms of what I was experiencing. But because the reason I bring that up is because at one point I tried fixing my canine with Invisalign, and things went horribly wrong. Whole nother story. It was during COVID, unfortunately, during August of 2020, and things went downhill very quickly for me. But once I disrupted that delicate bite that I had, because I didn't know that, it's a long story, but anyway, once I disrupted the balance that had been established in my mouth, I started breaking out again. And I was like, where's the what? How is this happening? I thought I got over this. But
So
to me,
fascinating,
it's
isn't it?
the oral cavity is such an important signal to the brain that everything is right or safe. And I try to explain that. I mean, it doesn't matter how many times I show how a missing molar will affect PRI testing. Like people still don't believe it until they see it happening with themselves. So the oral cavity, the trigeminal nerve is a monster. It's gigantic, and it has its tentacles in so many different areas of your cranium, and then down to C1, C2, C3 area, and your brain stem, and how that brain is integrating all this sensory input and feelings of safety and integrating sense of the ground and your own body. So to me that would, when I saw that research, I was like, oh my God, this must be that this validates what I was experiencing, that what I'm sensing through my feet, what's going on in my mouth would all influence histamine issues. And I thought that was just
And
just to
that
feel
is,
validated that I wasn't nuts. I knew what was happening, but then I found it in the research, like, there it is.
and looping that back around to hypermobility, if
Yeah.
they don't have a whole lot of groundedness, then no surprise they have massive mast cell issues.
Mm. And that can be experienced in how many different ways?
Mast cell activation?
Yeah, because it's a broad subject.
I mean, mast cell activation can be migraines, it can be GI distress, it can be reflux, it can be joint pain, it can be hives,
Mm.
it can be POTS like symptoms. I mean, there's mast cells can affect everything: runny nose, sores in your mouth,
And this is where you said in your
ringing in your ears, tinnitus.
so then this is where you said in your presentation, which I appreciate so much, was that people have different symptoms and they get all these different diagnoses and they're chasing all these different things around, and in reality it's still coming back to this one underlying issue, well, a structural issue that
Root cause.
creates all these different things. So how do people gather their intelligence and say, okay, this and this, they're not separate, they're these two seemingly distinct symptoms that don't seem to be related actually are. So
Well, I think, as I had mentioned in my presentation, that doing a really thorough intake and
mhm,
evaluating each system,
mhm,
so talking about the interstitial cystitis, which is the bladder irritation, and the ringing in the ears, and the chronic constipation, and the epicondylitis, and talking about how all of those things can be related. Really, you want to get a full picture of the person
mm,
and get a thorough evaluation. And then it's really a matter of looking at how can they be related, and then it's trial and error. And it's really, professionally, I think I've spent a majority of my career figuring out how to do no harm.
mhm,
Hence, as I said during my presentation, the name of my business means do no harm,
mm,
is try and figure out, okay, so you've got these 5 symptoms and all of them could be affected by how much caffeine you're drinking. 7 cups of coffee a day is not a great idea. So how
yeah,
about we talk about how getting your caffeine level down, and then we're going to work on getting you back into neutral. And so I always address PRI is my go-to,
okay,
right? Once I take a thorough history,
mm,
I briefly touch on inflammation with most people and all of the influences that can drive inflammation. And then I try and teach them something to help them be more neutral. I start with PRI.
yeah,
And that's where I go for probably 3 to 4 visits. Always coming back to, though, lifestyle, inflammation, posture, alignment, like all of those chronic things that can be driving problems as well.
mm,
Mast cell activation can be triggered by so many things,
yeah,
and it's a matter of really truly trial and error. And I really think you brought up a good point, which was it can be different every day.
mm,
Know
yeah,
how to manage and not being afraid of it.
mm,
That's the other thing.
Yeah.
You know, it's like knowing that if this, just because you have urgency because your bladder is inflamed and you go, that must be the coffee or the tomato sauce I had last night. Okay, well, I'll just have to do better today.
Mm.
And it's not like, oh my God, am I going to be in the hospital from this? Oh my God, like what, you know, like
Yeah.
fear, right, is going to help make the problem much worse.